everyone. Welcome to our live discussion today on how Texas citizens can work together to end veteran suicide and premature death. My name is Cherie Tham. I'm the co-founder and vice president of programs and initiatives at America's Warrior Partnership. Our mission at America's Warrior Partnership is to empower communities to empower veterans. And one of the most critical issues we're working to overcome right now is death through non-natural causes, particularly suicide. How are we doing that? We're doing that through Operation Deep Dive. Operation Deep Dive is a community-based veteran suicide and non-natural cause of death prevention study taking place in 15 states across the country, to include Texas. It is led by our team at America's Warrior Partnership and researchers from the University of Alabama with the generous support from the Bristol Myers Squibb Foundation. In our previous two broadcasts, we spoke with Dr. Eric Kane of the University of Rochester Medical Center about upstream approaches to community public health policies, and former U.S. Attorney Jay Town about the impact of veteran suicide in Alabama. You can view those discussions on the America's Warrior Partnership Facebook page. At the end of our conversation, we'll wrap up with information about what you can do to support Operation Deep Dive. Please feel free to post questions, and we'll save some time at the end of the discussion to answer your question. Today, I'm honored to welcome John Bursler, who serves as CEO of Combined Arms. John, please tell us about yourself and about Combined Arms.
Howdy, thanks so much for having us, Cherie, and good to see you and excited to continue to collaborate. My name is John Bursler. I'm on the Combined Arms team here in Texas, and we are really just excited to continue to share our innovative methodology and technology across the state of Texas in markets like Greater Houston and Southeast Texas, Austin, Central Texas, Fort Hood, Dallas and the Fort Worth, the North Texas region, areas of the Panhandle, and El Paso, to really ensure that more service members, veterans, and their family members are connected to the resources they need so that we can prevent issues like unemployment or substance abuse or family challenges or housing challenges, criminal behavior, and most importantly, suicide ever occur. So this project in particular is critically important to our overall success here in the great state of Texas.
Great, thank you, John. And in addition to what you're talking about that your organization provides, your team also is leading Operation Deep Dive in the state of Texas.
Yeah, we've had a great partnership with AWP and Operation Deep Dive in the University of Alabama since inception, I think, when you guys kicked it off. And it's been a great project to be working on, like I said, really make sure that we're doing as much as we can to better understand suicides that may happen in Texas, and in order to prevent future veteran suicides from occurring. And so we've been participating in not only Operation Deep Dive, but the Mayor's Challenge and the Governor's Challenge to better holistically address these major issues that impact our community.
Yeah, that's great. Partnerships across the state is how we all work together to support this effort. I want to talk a little bit about data. One of the components of Operation Deep Dive is a retrospective analysis of veteran death records within each state where the study is active. By coordinating data usage agreements with each state, we've been able to access all local death records from 2014 to 2019. We then verify this data against DoD records to confirm who in fact were former service members and what their service history was. This ultimately provides us a more accurate understanding of how many veterans have died within a state. The challenge we're facing, as you know, in Texas is we're unable to access the death records that include the Social Security numbers, which is required for the DoD to verify their service history. To overcome this challenge, we're calling on Texas citizens to assist us with the second component of the study. This is an opportunity for Texans to have a larger voice and provide the qualitative data we need to understand how communities can support our veterans prior to them reaching a crisis. So John, can you please tell our viewers how they can contribute to the study?
Yeah, absolutely. Thanks, Cherie. And as you said, really the most important way that Texans can really support this critical research by participating in an interview to really ensure that we're contributing to that secondary piece of the study. And what happens is those researchers are interviewing those loved ones of veterans who we have lost to suicide or a non-natural cause of death within the last 2 years. And what these interviews will focus on are really how their loved ones interacted with the community before their death that could give us some vital information about what happened. The people who participate in these interviews will help us to better understand the unique factors that impact veterans' well-being in our neck of the woods compared to other parts of the country. Ultimately, our goal is that we want to make sure that we give local service providers and veteran serving organizations a better methodology that will empower them to better direct our efforts in the veteran serving community to engage these veterans to enhance their quality of life and, most importantly, prevent future suicides.
Absolutely. These interviews are very important, but you and I both know this is a very difficult topic to discuss. How can organizations in Texas facilitate this? And how do you and Combined Arms leverage your partnership throughout the state to share information and resources?
Yeah, I think just by the biggest call to action for our organizations here in Texas, whether you're a federal agency, a state agency, or a community-based nonprofit organization, or just a member of our community, is to share that information on your own social media, share that on your organization's social media, reach out to veterans and families that have been impacted by this critical issue and see if they're willing to participate. We also regularly distribute all of this information about how to connect with Operation Deep Dive and all the interviews conducted on and how to access those interviews on all of our social media and email channels. So, be sure to keep on checking out the Texas Veterans Network and Combined Arms pages to ensure that you're kept up to date.
Great. Is there anything around Texas that you have seen has been a really supportive initiative around that's not necessarily just supporting Operation Deep Dive, but just supporting this as a mission? You mentioned the governor's challenge, the mayor's challenge, and I know you have a multitude of partners that are all working to support our veteran community throughout the state. Are there some best practices or some things with some of your community partners that you have seen that have been helpful in supporting?
Yeah, absolutely. On a monthly basis, we get together with all of the organizations based on the programmatic vertical that you work in, and we look at the data and we share these best practices. We share success stories on serving clients, and we also develop standards on how we can prevent all of these issues from taking root, most importantly suicide. And so I want to make, in terms of how the Texas Veterans Network and connecting better into that, is organizations and individuals can collaborate with us more effectively by joining those collaboration committee meetings on a monthly basis. And then we're also producing webinars on a weekly and monthly basis to really help further develop and professionally develop the veteran serving space here in the state and beyond. But Operation Deep Dive, as you mentioned, Cherie, is really helping accomplish all of this in Texas and better understanding suicide and how we can prevent it in the future. By studying the data and conducting these interviews, we'll have a better understanding of how we can proactively identify veterans and connect them to the resources that will not only improve their quality of life, but prevent a lot of these issues, as I mentioned: unemployment, substance abuse, family challenges, housing issues, criminal behavior, and most importantly, suicide. It all really starts with getting them connected to those resources and wrapping our arms around them before anything happens. And as we know, Texas may be the largest population of veterans after the Census Bureau releases the 2020 census results here later this year. If we might overtake California, depending on if everybody filled out the right forms this last year. But that presents an unprecedented challenge for us in the veteran serving space. And we're stronger together than apart. And that's why this initiative is so critically important.
Well, and you mentioned one of the challenges, or what other challenges do you see unique to Texas communities that's related to Texans dying prematurely?
Yeah, just getting the word out, and a lot of the 40% of the state's veteran population is rural. How can we reach those young men and women and their families that may not want to be reached if they're coming here from California or Missouri or Virginia as displaced workers and coming back to Texas? The biggest challenge that we have is wrapping our arms around these individuals and their families, and by really overlaying the bus maps and connecting the dots between federal agencies and state agencies and community-based nonprofit organizations, it gives us a much greater ability to not only proactively reach out to them and engage them, but also conduct this research study, which can lead to better outcomes and can lead to better understanding of the issues that ultimately lead to suicide.
Great. And so what I hear you saying is that Texas citizens can be a part of this larger piece by, if they've lost a veteran to suicide or other non-natural causes, that they can be a part of sharing that veteran story and that narrative, that maybe we can even learn more about what we can do to support our veterans in our communities. And I think and you've probably heard me say this a million times, John, and I know a lot of others, is, it's time that we support our mental health professionals in shouldering the quality of life for the citizens in our community. And this is a big way for us to do that as citizens within the United States, but as we're talking today, with Texas. So I want to talk a little bit about the way to participate. This is a good transition for looking at the future, and Operation Deep Dive is actively working to identify these issues John and I have both discussed today. But the critical question that continues to come up is, how can our viewers get started on supporting suicide prevention? And John talked a lot about how contacting us if you're eligible for participation, and being involved in this, and also as partners sharing this with the people that you work with, so that they know that this is an opportunity and that this is a resource. Those are two big ways that we can do that. So I want to talk a little bit about participant eligibility. This is actually happening. Operation Deep Dive is occurring in 15 states across the United States, Texas being one of them. And what we're looking for is family members, friends, caregivers who have lost a veteran to suicide or other non-natural causes, such as overdose, accidental gunshot, asphyxiation, drowning, who have lost that person within the last 2 years. We would like to interview you about their life and about specifically around the last year of their life. And so we'd like you to contact us if you would be interested in doing that. Thank you, John, so much. I'm going to do a recap, and then I'm going to open, I think we may have a few questions, and so I can look through those, and then you and I can answer some of those questions.
Cool. Thank you.
So we'll end with a recap on how our viewers can support Operation Deep Dive. We're currently looking for interview participants who've lost a veteran to non-natural causes within the last 24 months or 2 years, as I said. The goal of these interviews is to understand how a deceased veteran was engaged within their community and how the community can better support the veterans in the future. To participate, you must be over the age of 18. You must have a relative, loved one, friend, co-worker who was a veteran and died by suicide or non-natural death, again, within the last 24 months. Both you and the veteran you knew must have lived in the same community at the time of their death. Additionally, the community you and the veteran lived in must be one of the 15 states participating in Operation Deep Dive. Those 15 states are Alabama, Arizona, California, Florida, Georgia, Indiana, Kentucky, Minnesota, Montana, Nevada, New York, North Carolina, Ohio, South Carolina, and of course, Texas. If you're eligible and would like to participate or know someone who might want to participate, please visit americaswarriorpartnership.org/deep dive to contact our research team. And thank you all for your support and for tuning in with us today. So let me open up the Facebook and see if we have any questions.
Oh, Tyler asked, how can I support Operation Deep Dive outside of giving an interview?
Well, you guys heard, I'll speak about it in a minute, John, and then you can. His different partners throughout the state of Texas and sharing posts and sharing information with those that you serve. This is an extremely vulnerable position we're talking a very difficult subject matter. And so we're asking partners and individuals to let those that they know that they have a relationship with, let them know about that through your relationships, and that they can participate. But it's also word of mouth. I don't know if you have another thing to add with that, John.
Yeah, absolutely. Just, like the biggest call to action is to ask, your friends and family to share the information in case they may know a veteran or a veteran family who has been impacted. And then also ask the veteran service organizations in your area, no matter what part of the state you live in, to also share this information. We have a lot of great coalitions and collaborative groups around the state, and we'll be doing more work to push this information out to those groups so that they can help project the information to our greater community.
Agree. Do we have any other questions?
Yep, can you hear me? Okay, there we go. Leanne asked, talking about rural veterans, how do you find them?
I know, you want to answer that one?
Yeah, sure. There's no easy way to find any veterans, whether they're in a rural or urban or suburban area, if they don't self-identify. As I mentioned earlier, the greatest problem we have is that the Defense Department creates the largest number of displaced workers every year, with 200,000 men and women leaving one area of the country typically and then relocating to a completely different area. So we don't have all these professional and personal relationships and networks built like we did when we were in the military. So it's very difficult to find folks when we do scatter to the wind. I think some of the best ways to engage veterans are to connect with local veteran serving organizations and civic organizations, connect with local community colleges and technical colleges and universities where veterans and their families may be students and using their GI Bill or Hazelwood benefits, and also connect on social media groups. There's a ton of different informal groups and formal groups throughout the state of Texas and beyond that I highly recommend you get connected with. But we at Combined Arms have a rural veteran outreach program that we're trying to really connect with a lot of the county veteran service offices and the other agri-life extension agents that are really spaced out throughout the rest of the state to make sure that they have the resources that they need to connect veterans and their families to the social services, and more importantly, to this great study at Operation Deep Dive.
And I just want to add to that. A lot of times we think about particularly around this subject, we think about reaching rural communities, through mental health or through traditional veteran serving organizations within the communities. Historically, one of the ways that we were successful in finding rural veterans is to inform places like libraries or physicians' offices. You think outside of what makes up your community and where are people traversing on a day-to-day, kind of basis. And so it's not just mental health providers. It's not just direct service providers, but it's also thinking outside of what makes up your full community and targeting what we call maybe ambassadors. And any other questions you see, John?
Okay. Oh, looks like we have another, just a couple of great comments. Thank you, Melissa. Fantastic work you're doing with the county service office and with the food pantries. Food banks, as we've seen over the course of the pandemic, have been critically important in serving veterans. So, getting the word out through food banks, which typically have a very big marketing apparatus, could be another way to get the word out. Let's see. And Leanne, thanks for Leanne. She's also saying that she works with 29 rural communities in West Texas and 6 VSOs in those counties. And Sheenley, how do we get in touch with both me and Cherie? And she's done a suicide study as well and would like to share. So I'll put my email address in the comments, and Cherie, I'm sure that's okay with you too, for these folks to reach out. And then I know Crystal has been putting and sharing her contact information as well.
Exactly. Yeah. Great. Well, thank you so much for joining me, John. This was a wonderful discussion. I really appreciate it, and all the hard work that you guys are doing in Texas to lead the effort around Operation Deep Dive. And thank you to all of our viewers. And we really appreciate you. And we'll see you next time.
Thanks so much, Cherie. Thanks for everything you guys are doing. Can you hear me? Right. Oh, there you go. Okay, thanks. Bye. Thanks for having me. Okay.
Bye.